we'll move on to your photo, which is this.
Okay.
Great.
So I just push here.
Well, you're all set.
Okay.
The photo's up.
Okay, great. Hi, everybody. I was going to say exactly what Dr. Enzinger already said, which is, how about you take a minute to have a snack, to stretch? You've been such an attentive audience. If you want to stand up and move around, or sit in your chairs and move around. This is a long day, and there's lots of wonderful information. But I want you to take care of yourselves in the midst of all this. So I am very happy to be here to talk about psychosocial support and survivorship. I wanted to thank Dr. Bass, Dr. Enzinger, and Debbie's Dream Foundation for making this conference happen. It's so important to have a chance to get together, to learn, and to get to know each other. So as Dr. Enzinger mentioned, I have been a clinical social worker at Dana-Farber for 21 years. I feel like Dr. Enzinger and I kind of grew up here together. And I love my work, and I've been in the GI clinic most of that time and really, really value the connections I have with my patients and their families. So as social workers, as you may already know, we help patients and families cope with the emotional aspects of diagnosis, treatment, and beyond. And we offer connections to resources and community supports. We help with communication and really focus on quality of life at all stages of illness. And you will notice I do not have a PowerPoint. I have a photo of one of my favorite places in the world. That is Ogunquit, Maine. It is the view of the ocean from the Marginal Way, where you can walk along the ocean. So you can look at that and relax, because part of what this is about is really how to cope with all the stress and strain related to illness. And one of the things that helps is finding the things, the places, the people you love, and holding on to those. So I will look forward to any questions you have coming up, because I really want to know what's on your minds. But I want to talk today about the emotional aspects of these illnesses, these diagnoses. And I also want to say that a lot of what I do really is channel the wisdom of the patients and families who have gone through this before you, because really you are the experts in how to cope. You are doing this every day. So a lot of what you hear are from conversations I've had with people over the many years I've been doing this work. And I think everyone would agree that what happens at the time of diagnosis is that your life is turned upside down. So in general, I think there is an initial period of grieving that goes on really no matter what stage, what age you are. There really is this type of grieving for the life that you had before cancer, for the changes in your health, for the changes in your roles and responsibilities within your family, within the workplace, and really ultimately changes to your sense of identity. So I want to say right up front, and I'm sorry, my voice is a little shaky because I'm getting over a cold, but I want to say that one of the things I say to my patients and families is all feelings are welcome here, and all feelings are normal when you're undergoing this kind of disruption in your life. There may be sadness, there may be anger, oftentimes worry or fear. Honestly, sometimes there's relief in the sense of knowing what's been going on. People may have been having symptoms for some time and worrying and not knowing. And then to have a diagnosis, as difficult as that can be, can also give a focus and a path forward. So sometimes when I see people on their first treatment day, they're actually feeling a lot of hope. They may be feeling sadness and worry and all those other things as well, but there also is the hope that now something can be done. Now we can move forward. Over time, I think what people would say, and what all of you may have experienced, is that you really find a new normal, a different kind of balance, a certain routine that now includes a new team of people who will care for you, and that may vary depending on where you're treated or what your particular needs are, but we really are united, the physicians, nurse practitioners, PAs, social workers, infusion nurses, radiation, oncologists, gastroenterologists, surgeons. There's just a whole list of people. A lot of my patients get these big notebooks with places for all the cards, and they often have 50 different cards so that they have those as a reference. So we all want to be here for you while you're going through this time. We have knowledge to share, and we have support to offer. So all those feelings are normal. How do you know if you need more help? Because sometimes things can really feel pretty incredibly awful. So I think one of the ways to know that is if you're feeling especially overwhelmed over an extended period of time. I think anytime you're going through something like this, you're going to have times of feeling overwhelmed, days where you might cry more or be more angry or withdrawn. But if that persists, if that type of pattern persists over time, then that's something to look at. And if you're feeling a real sense of despair or hopelessness, I'm naming all of this because these are things that we don't always talk about, but I hear in my conversations with patients and families that oftentimes there are those kinds of feelings. And it's also pretty normal and common to have those, but it indicates that we need to pay more attention to helping you get back that sense of hope that's going to be important in moving forward. Also, if your sleep is seriously disrupted, you're not sleeping much or you're sleeping too much. Eating, I know eating is such a loaded issue with these diseases. Eating alone, if you're not eating very much or if you're eating a lot, that sometimes is a symptom of depression. It's sometimes just a symptom of your diagnosis or your treatment. You may just not feel like eating at that point in time. But if you see a pattern, that's an important thing to pay attention to. And I guess the other thing would be if you've lost interest in your usual activities, the activities that ordinarily would give you some sense of happiness or peace, but right now you just don't feel like doing much of anything. And again, some of that's totally normal, but if that is a persistent feeling, it's good to talk with one of us and get some help with that. And along with that, I just want to say that people bring their life stories with them to this experience. Many of you have had years and years of family life, work life, all kinds of things that have been important to you, many strengths you've developed over those times, and probably some challenges that you faced as well. So those things are going to affect how you deal with this illness. A lot of times I talk with people about remembering another challenging time, perhaps another illness within the family, perhaps some losses within the family, perhaps changes with your work or your relationships, and you can call upon those strengths, you can call upon those coping mechanisms to help you through that time. Some people come into this with some trouble in their relationships. Sometimes there's conflict in a marriage, sometimes there are mental health or substance use challenges. And again, I think the important thing is to be able to talk about this and think about how this is going to affect your ability to get through this time. And I will tell you, in all these years I've been doing this work, I have never seen two family members cope in exactly the same way. Oftentimes in the family, there will be someone who's the cheerleader, there will be someone who's taking care of all the details, there will be someone who's feeling more of the sadness. The real trick is to find ways to bridge those differences, and that's what a social worker or other people within the team can help you with, because it really makes sense that people are going to respond to this in different ways. And the trick is to keep talking and to keep the communication open. I also wanted to talk a little bit about caregivers and family support as we're talking about what goes on for families. And a lot of times I've had people say to me, it's so hard to be the person sitting in the infusion chair or having the surgery or going to radiation, but it's equally hard in a different way to sit next to someone you love who is going through those kinds of things. So there is a particular type of stress and strain that caregivers experience. I've had plenty of caregivers say to me, I wish I could change places with them. I wish I could make this go away. I feel helpless. Again, all of those feelings are quite normal, but also often a good thing to talk about, because it really is painful not to be able to make the cancer go away. There are things that you can do just by being present. There are things that you can do by offering a favorite food or going for a drive or visiting the ocean, the things that can give you some happiness. But caregivers and family members are holding a lot along with the patient. And I think I've been doing this work a long time, even beyond my time here, and I think we didn't used to pay so much attention to caregivers. We were so focused on trying to get the patient through treatment. But, more and more we're recognizing what an impact it has on everyone in your life. The other thing I wanted to mention are children and grandchildren, because they are certainly profoundly affected, whether it's their parent or grandparent going through this, when they're very close. They may have a lot of questions. You may not be able to do the usual mom, dad, grandparent kinds of things that they're used to, and that's a loss for them. I will say that I have seen over the years how amazingly resilient kids are, and that if they have the knowledge, the information to cope, and the support that they need, they actually can cope with anything that might come up in these illnesses in your care going forward. But it is really important to be able to speak with them openly and honestly, focusing on what is appropriate for their age. Obviously, with the youngest kids, they're more concerned about whether you're going to be able to be around, even more separation anxiety when they're really little. When they get more into school age and teenage years, they can have an actual understanding of what cancer is about, that you're having a treatment day. I have patients whose kids draw pictures for them on treatment days. The young adult kids send them texts. There certainly are kids who struggle, and there certainly are kids who really don't want to talk about it. So again, there's a whole range of how people respond. But I think in general, and we could do a whole hour about this, but in general, if you're open and honest with your kids, if you welcome them in, if you invite them to be part of this process, they're going to get through it along with you. If they can bring you a ginger ale, they can do things around the house to help. There's a lot of things that can help them with their feeling of helplessness, which is similar to what the spouses and caregivers can oftentimes feel. So I have a number of other things to talk about. Are there any questions right now about those things I've talked about so far, about kids, caregivers, the initial emotional response to diagnosis? I know it's kind of the pattern to wait till the end here.
Got a question over
Okay,
here.
great.
Hi, Jane. I don't know if this is kind of related to what you're saying, but I noticed in the room when we're all waiting, I shouldn't say all waiting, the patients for treatment, there are no cancer support groups for stomach cancer.
Mm-hmm.
So why is that?
Yeah, so that's an excellent question. And that's a good segue, Kathy. Thank you.
I don't want to lead it. I'm just asking.
No, so one of the things that I want to talk about is how you can get support and what you can do. I've kind of outlined the issues that come up, but obviously we want you to have a sense of what you can do. We do not currently have a GI cancer support group at Dana-Farber. We are working on starting one. It probably will be more general, not just stomach cancer. It probably will be a number of different GI cancers, but we have found when we've done those groups in the past that there's been a lot of common bonds, a lot of common concerns that we can address that way and help people connect with each other. There are other ways to connect with groups. I was on the Debbie Stream Foundation website. There's a lot of really wonderful information there, as well as the opportunity to connect with a mentor, other ideas about groups, online groups. There's also a cancer care organization, Cancer Care, which is out of New York, but it's a national organization, and they have wonderful online support groups, and they are really quite specific about the type of cancer. It's not the same as sitting down in the same room, but I think it's the way the world is kind of moving, and it's also helpful for people who might have a hard time getting out to a group. So those are some of the resources, but I agree with you. I think there's nothing like group support, because talking with people who are literally, going through the same situation is really, really powerful. So thank you for that question, and we are working on doing something here in the new year. Yeah. So there are a couple of different things that can happen. So for some people, there will be a diagnosis, treatment, and then you'll be on surveillance. You'll be essentially done with treatment. And at that time, there may be a tremendous amount of relief. There may be celebration going on. But I just want to say that that also is a time when sometimes people have some of the emotional concerns, some of the sadness and worry come up as they come off of treatment, because it can end up leaving you, can end up making you feel a bit cast adrift, because even though you are not wanting to continue on forever with treatment, if you're in that situation, the truth is that this becomes a kind of second family for a lot of people. So it's a lot to let go of. And again, it really makes sense that people would have some feelings about it and some worries about whether the cancer will come back. So there are particular times of transition with treatment and survivorship where people do have heightened emotional concerns. And you all know this. Scans, right? Scanxiety is the term, and it's universal. It just happens because this is what's determining where you go from here. So I think for people who are going through their initial treatment, those are the kinds of things that get stirred up. Then we have the situation where you're really going to be going through treatment on an ongoing basis, and where this is more of a chronic or sometimes life-threatening situation. So I think in that situation, what the primary task really is, again, channeling the wisdom of my patients and families, is how to sustain hope in the face of uncertainty, because you don't know for sure what's going to happen when, if this treatment will work. There's so many good things happening. I love coming to these conferences because I get to hear all the progress we're making. And over the 20 plus years I've been here, I've seen amazing things, much more targeted therapy, many better ways of managing side effects. There's so many good things going on. But there's also the roller coaster of emotions that go along with the scans, any changes in treatment, hearing that the options are more limited. So I think I wanted to talk a little bit about what helps at those times, and then about where you can turn for that help. I think any of you who've ever met me, and I do have some familiar faces here in the audience, know that one of the things that can help is creating structure, having time in your day for the things that are important, having a reason to get up and get out of bed if you're not working anymore, continuing to work if you feel well enough, those kinds of things. I think also, I was talking earlier about if you don't have those feelings of happiness or peace with things in your life, trying to figure out one thing a day that's really meaningful to you. It might be something really small, just, looking at your garden, watching a TV show and laughing with someone you love. It doesn't have to be a big deal, but it can be really helpful to reclaim some of those things, to reclaim as much normalcy as you can in your life. I think also some of you may know, here and elsewhere we have what we call integrative therapies, integrative medicine, and that includes acupuncture, massage, Reiki, nutritional consultations, and those kinds of things can also really help to reduce stress and anxiety while you're going through this, and help you feel better in your body, help you manage some of the side effects or symptoms you may be having. And I think probably everybody always hears about exercise and how important that is. There is absolutely a lot of truth to that. Sometimes it's hard because the last thing you feel like doing is getting up and going outside, or going to the gym, or even walking around the block. But even if you can do a little bit, if you can be out in the natural world, if you can see things that are beautiful, that makes such a difference. Because one of the things I know, particularly about anger and anxiety, is that talking about it is good, but it also needs a physical release. Sometimes I encourage people to get punching bags and put them in their basements, because you may have this anger about the cancer, about the traffic on the way to the treatment center, all the things that go along with this illness, but you need a way to get that out. So I actually have had a number of people go and get punching bags, and they've had a good time with it, actually. The other thing that I wanted to mention, which I'm sure you've also heard a lot about, is mindfulness and meditation. So a lot of people say to me, Jane, I can't meditate, my mind is too busy. But the truth is, all of our minds are so busy that it's not about your mind becoming a blank slate or completely peaceful. And it's really more about being in the moment with whatever is going on. And some of those moments are pretty unpleasant. So sometimes, it's hard to sit with that. But over time, what you develop is the ability to have perspective on that, to be observing what's going on rather than be pulled apart, pulled in different directions by the emotional ups and downs. And I've had people who've been very skeptical about this, and then they have given it a try, and they have been surprised, that it actually was something that worked for them. It's not for everyone. Nothing that I'm talking about is for everyone. Not everyone wants a support group. Not everyone wants meditation and mindfulness, but what I like to do is offer people some tools that can be helpful. I think another thing which, Debbie's Dream Foundation and the Esophageal Cancer Awareness Association, all these organizations and places like Dana-Farber have a role in advocacy for more funding, for more research, for more to be available to work toward a cure for these diseases. And I think it can be very powerful, very empowering for patients and families to get involved and to really be part of that, so you feel like you're making a difference not just in your individual situation, but for other people going through similar things to what you've been going through. We have here at Dana-Farber social workers, psychologists, psychiatrists. We work closely together to help support people with their emotional concerns, their family issues. We do different types of counseling. I think some of the things that can be helpful for the issues I've talked about are cognitive behavioral therapy and something called acceptance and commitment therapy. I really would encourage you, whether here or elsewhere, to seek out that support. I think it can help really in terms of your emotional quality of life and in terms of family relationships as you go through this. The other thing already mentioned, support groups, websites, peer-to-peer connections. We have some here. These organizations also have mentors, one-to-one connections. Again, just to know someone who's farther down the line, like how they got through the initial surgery or how they're getting through a change in chemotherapy. It can be really helpful. And I wanted to mention one other topic. So here we are fortunate to have resource specialists and also people who help with pharmacy issues and government types of programs. I really want to say there are so many ways in which this is a stressful time, and one of the biggest ways is financially. You may not be able to work, you may be working less, you may be on disability. So there's the financial strain, there's the cost of care, there's the cost of medications. There's so much going on. So, there are some kinds of resources out there. I wish there were more. This is part of my advocacy, is to try to get more funding for patient care, as well as the importance of research and treatment. But really, it's always a good idea to ask if you're feeling under financial strain. And, there are things like disability, Social Security disability. Actually, also the website, Debbie's Dream Foundation, has some videos specifically about applying for Social Security disability. And really, there are just a lot of resources out there. And to not be shy about asking your team for some additional support and help with those kinds of things. You know, we understand that this impacts your life on so many levels, and we want to help you in all the different ways that we can. So I think that's where I'm going to stop. I am going to do a 20-second mindful moment with you. And one of the things that I love are guided meditations, sometimes just sitting. You know, I did not meditate for years, and then I started, and now I love it. I do it every day, but I mostly do guided meditations. And one of the things that I teach my patients and that I do myself is just this very simple one, which is breathing in, I calm my body. Breathing out, I calm my mind. And if you do that a few times, breathing in, I calm my body. Breathing out, I calm my mind. If you come back to your breath, people who love meditation would say that you can ground yourself in your breath. You can ground yourself right where you're sitting if it's too hard to focus on your breath because of what's going on health-wise. You can ground yourself in the sounds around you. There are many different ways. But if you can come back and you can just take a breath and remind yourself that in this moment, you're okay. In this moment, you're sitting, you're doing what you need to be doing. Things may not be exactly as you would wish, but it gives you the reminder that there are many moments and that things come and go, and some days will be harder than others, but ultimately there is hope as this time goes on. Hope for different things sometimes evolves over the course of this illness. But I really think that you all have so much strength and resilience within you, and you have each other. And I hope you get to know each other, that you've gotten to do that throughout the course of this day, because that is one of the most valuable parts of this conference, is for you to know other people going through this. So thank you very much for your time.
Thank you, Jane. I did feel I felt quite calm there during that.
Good.
Yes.
Could do a whole half hour of just meditation.
So we're going to move on now to the panel discussion. So Jane, if you wouldn't mind joining everybody else at the table there.